So imagine going to bed, right? You're totally exhausted.
Oh, yeah. Just desperate for a good night's sleep.
Exactly. But the moment the lights go out and your head finally hits the pillow, your body basically turns into its own worst enemy.
Right.
There's this unbearable, localized pain and this itching that just spikes out of nowhere. And you eventually find out that your own immune system is actively trying to erase parts of your anatomy.
It's terrifying.
It is. And for the people we're talking about today, I mean, this isn't some nightmare. It is literally just a Tuesday.
Yeah, it's a brutal reality. We operate on this basic assumption that our internal defense systems, that they know who the enemy is.
Right, like they know the good guys from the bad guys.
Exactly.
Yeah.
But when that biological contract breaks down and the immune system turns its weapons on healthy tissue, the physical and emotional toll is it's staggering.
And what makes it so much worse is the isolation. The condition we're looking at today is something people suffer with in silence for years.
Oh, absolutely. Years before even getting a diagnosis.
Yeah. Right. It's this chronic inflammatory skin condition called Lichen Sclerosus, or LS. And today we are taking a deep dive into a very specific question that patients are asking.
Usually when they are completely at the end of their rope seeking relief.
Exactly. The question is, can acupuncture actually treat it?
Which is such a fascinating focal point. Because asking whether a traditional Eastern therapy can treat a complex autoimmune disease, well, it forces us to look at the massive philosophical divide between how Western medicine and holistic practices view the exact same symptoms.
Right. And to figure this all out, we're pulling from a really diverse stack of information for this deep dive.
We really are. We've got the 2021 European Guidelines for the Management of Vulval Conditions, clinical guidance from the British Association of Dermatologists.
And we also have notes from holistic clinics, plus some modern functional medicine protocols.
Yeah, it's a lot of ground to cover.
It is. So whether you are dealing with a chronic condition yourself, supporting someone who is, or you're just insanely curious about how these different medical ecosystems work, this deep dive is really going to challenge how you think about treating the human body.
Absolutely. But to understand the treatment, we really have to look at the baseline destruction of the disease first.
Right. Let's lay the groundwork.
So lichen sclerosus is an inflammatory dermatosis. The general medical consensus right now is that it's an autoimmune condition, likely with a genetic predisposition.
Okay.
And while it can, show up extra generally, like on the breasts, the back, or the shoulders, it primarily targets the anogenital area.
And it predominantly affects women, right? Like mostly postmenopausal women or prepubescent girls.
Primarily, yes. Though, men and boys absolutely get it too. It's not exclusive.
I was reading through the clinical descriptions of the symptoms, and it's genuinely difficult to process.
It really is.
You're talking about an area of the body with incredibly delicate tissue. And the primary symptom that just drives people completely crazy is this intense, agonizing itching.
Yeah, the itch is debilitating.
But I noticed in the clinical data that it always seems to get significantly worse at night. Why does the timing matter so much?
So that comes down to the body's natural hormonal cycles. Cortisol is basically your built-in systemic anti-inflammatory hormone.
Okay, right. The stress hormone, but it also fights inflammation.
Exactly. Throughout the day, your cortisol levels are relatively high, which essentially keeps a lid on some of that baseline inflammation. But as you prepare for sleep, your cortisol naturally drops.
Oh, well, so that built-in protection just, vanishes.
Exactly.
Yeah.
The anti-inflammatory shield is lowered, so the local immune response to the inflammation in the skin spikes dramatically.
That makes so much sense.
Yeah, and that leads to severe nighttime itching that just completely derails a person's sleep architecture.
I can't even imagine. The psychological dread of knowing the sun is going down and the itch is coming. It must be overwhelming.
And, this isn't just an itch. It physically alters the tissue. The sources describe the skin turning white, crinkly, and resembling tissue paper.
Tissue paper skin. That sounds so fragile.
It's called epidermal atrophy. The skin loses its elasticity, becoming incredibly delicate. And if it's left unchecked, chronic inflammation leads to profound architectural changes.
And by architectural changes, you mean?
Well, in women, this means the resorption or flattening of the labia minora, the narrowing of the vaginal opening, and the clitoris becoming completely buried under scar tissue.
The tissues literally fuse together.
They do. It's awful. And in men, it causes phimosis, where the foreskin tightens and just cannot be retracted.
Oh, man.
Or they develop severe severe urethral strictures, which makes it difficult or incredibly painful to even pass urine. For anyone affected, it causes tearing, bleeding, and just immense pain during sexual intimacy.
That is wow. And the British Association of Dermatologists notes that untreated chronic LS comes with a genuinely heightened risk of developing localized squamous cell carcinoma.
Right, skin cancer.
So, obviously, conventional medicine has to act fast. Looking at all the medical sources we have, the absolute gold standard across the board is ultra-potent topical corticosteroids.
Yes, the universal first-line defense. Doctors prescribe highly concentrated steroid ointments like clobetasol to be applied directly to the affected tissue.
Okay, let's try to visualize what this is actually doing. If you have this raging autoimmune fire burning in the local tissue, the clobetasol is basically like a highly specialized fire squad.
I like that analogy.
Right. It's a chemical fire retardant that aggressively suppresses that local immune response. It puts out the flames to prevent the house, the genital architecture from burning down and fusing together.
Yeah, and if we take that analogy a step further, the fire squad is completely non-negotiable. You have to stop the immediate destruction of the house.
Obviously.
But putting out the fire doesn't rebuild the drywall, right? It doesn't fix the charred foundation. And crucially, it doesn't stop the arsonist who started the fire in the first place.
Because the arsonist is the underlying immune dysfunction.
Precisely. Steroids manage the immediate symptoms beautifully for a lot of people. I mean, they are critical for stopping that tissue scarring and mitigating the cancer risk, but they are a localized Band-Aid for a systemic issue. Plus, chronic use of ultra-potent steroids can actually thin the skin over time.
Which is already fragile from the disease.
Exactly. It's a bit of a scorched earth policy on tissue that is already compromised.
Which makes total sense as to why patients end up searching for alternatives. Like, if the steroid is just suppressing the local flare and causing thinning skin as a side effect, patients want to know how to catch the arsonist.
Right. They want root cause resolution.
Yeah. And I noticed in our stack of sources there are clinical notes from a holistic practitioner, Betsy Gordon.
Yes, who specializes in traditional Chinese medicine dermatology.
Right. And the way she treats LS patients seems completely opposite to the standard dermatological approach.
Holistic modalities, like TCM, view the skin as a monitor. It's essentially displaying the internal environment of the body. So Western medicine sees lichen sclerosus as a localized skin problem to be suppressed topically. TCM sees it as an alarm bell for systemic dysfunction.
But I'm looking at her clinical examples, and she's treating patients who have the exact same white patches, the exact same medical diagnosis, but she's treating them entirely differently.
Yeah, she is.
Why wouldn't she just use a standard, alternative protocol for LS?
Because in TCM, the local symptom isn't the disease. The systemic pattern is the disease.
Wait, explain that a bit more.
Sure. So one patient might present with sudden, bright red, incredibly itchy perianal LS. In TCM diagnostic terms, that presentation correlates with deep-seated digestive heat or acute toxicity.
Okay, so it's linked to the gut in that case.
Exactly. But another patient might have a slow, gradual onset of vaginal dryness, pale tissue, and chronic pain. That pattern correlates with a deficiency in the body's nourishing fluids and chronic nervous system exhaustion.
Oh, wow. So even though Western medicine hands them both the exact same tube of steroid cream?
TCM says these two people have completely different internal climates that are manifesting a similar skin symptom.
That is fascinating. So Western medicine treats the what?
And TCM attempts to treat the why. The holistic protocol is framed as whole systems rehabilitation.
Which means?
It combines acupuncture with highly potent phased herbal medicine.
Okay, explain the phases to me, because I read that they are drinking these intense herbal decoctions and the ingredients actually change based on what the skin is doing.
Yeah, the herbal strategy is highly targeted. In the initial phase, when the tissue is swollen, actively inflamed, and painfully tearing, the herbs prescribed act similarly to mild anticoagulants.
Wait, hold on. How does moving stagnant blood heal an autoimmune skin lesion?
Think of acute inflammation as a traffic jam in your vascular system.
Okay, a traffic jam.
The local tissue is flooded with inflammatory cytokines, and the microcirculation gets totally blocked. The tissue literally can't breathe, and it can't clear out the cellular debris.
That makes sense, yeah.
So by using herbs that promote blood movement, you are flushing that stagnant inflammatory fluid out of the microcapillaries. You're restoring fresh oxygen and nutrients to the site.
Oh, that's clever.
Right. And once that initial swelling and redness are calmed, the practitioner shifts to a second phase of entirely different herbs.
And what do those do?
Those are aimed at encouraging actual tissue regeneration. They nourish the area.
I mean, it sounds incredibly thorough.
Yeah.
But looking at the logistics, this is not a quick fix.
Not at all.
We're talking about a full course of treatment that can take up to 6 months. And the cost can range from $200 to $800 or more, depending on the severity.
It is slow medicine. It requires a massive investment of time, money, and lifestyle adjustment.
Okay, hold on. This is where I had to push back a little. We need a reality check here.
Go for it.
We are talking about a disease that physically alters anatomy. It fuses skin together. It buries the clitoris.
Yeah, it causes severe structural damage.
You cannot tell me that drinking herbal tea and getting a few acupuncture needles placed in your legs or arms is going to unfuse a scarred clitoris. Are we just talking about a really expensive placebo effect here?
That's a totally fair question. And if a practitioner claimed that acupuncture or herbs could magically reverse severe anatomical scarring or, like, unfuse the skin, then yes, we would be in the realm of biological fiction.
Okay, good. I'm glad we're on the same page.
Right. But that is not what the clinical data actually supports, nor is it what responsible holistic dermatologists claim.
Let's get to the hard data then. When we ask the core question of this deep dive, can acupuncture actually treat lichen sclerosus? The medical sources in our stack seem completely split.
They are very divided. The Women's Health Clinic, which is a major evidence-based practice in the UK, they draw a very hard line.
Yeah, they state emphatically that there is no scientific evidence that acupuncture can treat lichen sclerosus or reverse its underlying autoimmune cause.
Right. They insist it should absolutely never replace medical therapy, like topical steroids.
So they basically view it purely as a relaxation tool, nothing more.
Pretty much. But then you look at the 2021 European guidelines for the management of vulval conditions.
And these are incredibly strict, rigorous medical guidelines used by dermatologists across Europe.
Exactly. And tucked right in there, it explicitly notes that acupuncture has shown effectiveness in clinical trials for these patients.
Which is wild. Why would strict Western dermatologists include that if it doesn't unfuse the skin?
Because of what acupuncture is actually fixing. The trials don't show acupuncture reversing the autoimmune disease at a cellular level.
Okay.
What they show is that it is highly effective at treating the devastating secondary symptoms of the disease.
Oh, like the pain.
Yes, it reduces chronic pelvic pain, it improves sexual functioning by minimizing dyspareunia, painful sex, and it profoundly downregulates nervous system stress.
So there's a difference between curing the cellular disease and treating the person experiencing the disease. But how is sticking needles in the skin physically reducing pelvic pain and stress?
Yeah.
What is the actual mechanism there? Like, what's happening in the body?
It comes down to neurobiology. When acupuncture needles are inserted into specific points, it stimulates the peripheral nervous system.
Okay.
This sends a signal up the spinal cord to the brain, specifically triggering the release of endorphins, which are the body's natural painkillers.
I've heard of that, yeah.
But more importantly, for an autoimmune condition, acupuncture strongly stimulates the vagus nerve.
The vagus nerve. Wait, that's the one that controls the parasympathetic nervous system, right?
Yeah.
The rest and digest state.
You got it. When you are in constant agonizing pain from a condition like LS, your body gets locked in a sympathetic fight or flight state.
Because you're constantly under attack.
Right. And when you are in fight or flight, your body pumps out systemic inflammatory chemicals.
Which makes the autoimmune reaction worse. Which makes the skin hurt more. Which creates more stress.
Exactly. It's a massive biofeedback loop. Acupuncture acts as a circuit breaker for that loop. By stimulating the vagus nerve, it forces the nervous system out of fight or flight and into a restorative state.
Oh, I see.
When systemic stress drops, systemic inflammation drops. You aren't curing the skin cells directly, but you are turning down the volume on one of the primary triggers for LS flare-ups.
Okay, so if the steroid cream is the fire squad suppressing the local flames,
Yeah.
and acupuncture is the circuit breaker calming the nervous system and the pain, do patients have to choose between them? How does a patient actually navigate a medical system that seems so divided?
Well, the most successful approach, according to the overlapping data in our sources, isn't about choosing sides. It's about building an integrative ecosystem.
Meaning they use both.
Exactly. Both conventional dermatologists and holistic TCM practitioners agree that acupuncture and holistic dermatology are entirely safe to combine with topical steroids.
So you don't have to abandon your medical safety net to get systemic support. That's huge.
No, you don't. In fact, combining them often improves overall outcomes. Patients construct a functional, multi-layered approach. Beyond the steroids and acupuncture, they rely heavily on topical and herbal adjuncts to protect the tissue on a daily basis.
Yeah, the symptom relief from these adjuncts seems really significant for patients. Emollients and barrier creams are universally recommended across the board.
They are essential.
I read that women are using natural oils, like coconut oil, for its baseline antibacterial properties,
Yep, coconut oil is great.
or olive oil, simply to keep the fragile skin from cracking after they use the restroom, because regular toilet paper can just shred that tissue.
Yeah, it's about minimizing friction. And then you have medicinal herbs with studied topical benefits that patients incorporate into salves.
Like what?
Calendula is frequently used for its powerful antibacterial and anti-inflammatory properties.
Oh, I've seen calendula in a lot of skin creams.
Right. Chickweed is often added specifically to soothe that maddening, sleep-depriving itch. And gotu kola is utilized to promote collagen production and wound healing, which helps minimize the scarring from active lesions.
That's amazing.
Yeah.
But the integrative approach doesn't stop at the skin level, does it?
No, it goes much deeper.
I was reading the functional medicine protocols we have from Dr. Will Cole, and he brings up a really unexpected connection. He links lichen sclerosus heavily to gut health.
Ah, yes. The gut connection.
I mean, why on earth would an inflammatory skin condition on the genitals be caused by the stomach?
This is where we get into the functional medicine theory of autoimmunity. Specifically, we're looking at gut dysbiosis and something called intestinal permeability, or leaky gut.
Leaky gut. I've heard the term, but what does it actually mean?
Basically, the lining of your intestines is supposed to be a tight barrier. It should only let fully digested nutrients into your bloodstream. But chronic stress, poor diet, or certain medications can cause that lining to become permeable.
It gets tiny holes in it.
Essentially, yes.
So undigested food particles and bacterial toxins are literally leaking into the bloodstream.
Yes. And your immune system spots these foreign particles floating around in the blood and mounts a massive systemic attack.
Okay, I follow that the immune system gets fired up. But how does a leaked food particle translate to the immune system specifically attacking the skin of the genitals? Why not the elbow?
That is the million-dollar question. And the current working theory points to a biological phenomenon called molecular mimicry.
Molecular mimicry, let me guess. The proteins look similar.
You nailed it. The amino acid sequence of the toxins or food proteins leaking from the gut closely resembles the protein structures of the tissue in the anogenital region.
Oh my gosh.
Right. So the immune system creates antibodies to hunt down the gut toxins, but because the genital tissue mimics the look of those toxins, the immune system gets confused.
Wow.
It starts destroying your own healthy tissue via mistaken identity.
That is wild. So the arsonist isn't even in the neighborhood. The arsonist is operating out of the gut, sending confusing signals to the immune system.
From a functional medicine perspective, yes, exactly. Which means if you want to stop the autoimmune attack, you have to heal the gut lining.
And the sources mentioned that the primary way patients do this is through diet. Specifically, these therapeutic diets like the autoimmune protocol or AIP.
Yes, AIP is very common for this.
This is a rigorous elimination diet that removes known inflammatory triggers, things like gluten, dairy, and refined sugar.
Right.
And the goal is to give the intestinal wall time to heal, seal the leaks, and stop confusing the immune system.
It requires immense discipline. I mean, it is not easy. But for many patients, managing their diet is the tipping point that finally brings their chronic flare-ups under control.
Let's bring all these pieces together. We started with this idea of a fire squad. But looking at this whole integrative approach, managing lichen sclerosus is really like maintaining a highly complex garden that has been attacked by an invasive, destructive weed.
That's a beautiful way to look at it. The clobetasol steroid cream would be your highly targeted weed killer.
Right. You absolutely need it to keep the immediate threat at bay and stop the weeds from permanently choking out the healthy plants.
You have to stop the damage.
But if you just spray weed killer every day, you scorch the earth. The soil becomes thin and depleted. The weed killer doesn't make the garden healthy, it just stops it from dying.
Which is where the rest of the ecosystem comes in.
Exactly. The acupuncture stimulating the vagus nerve, the AIP diet healing the gut, the calendula salves providing topical nourishment. That is your fertilizer, your watering schedule, and your deep soil maintenance.
It's everything that sustains life.
You need all of it working together. You need the weed killer for the acute crisis and the soil maintenance to keep the entire ecosystem so resilient that the weeds struggle to even take root again.
It's a comprehensive strategy that honors the reality of the patient's lived experience. It validates that, yes, localized medical intervention is absolutely necessary to prevent permanent damage,
Right.
but whole body support is what provides true healing, resilience, and a return to quality of life.
So, circling back to the question that started this entire deep dive, can acupuncture actually treat lichen sclerosus?
The honest, data-driven answer is that acupuncture alone will not cure the cellular autoimmune disease.
And it should never replace your prescribed steroid ointment.
Absolutely not. But it is a scientifically recognized, highly valuable tool in the toolkit. It breaks the cycle of flare-triggering stress, it manages chronic pain, and it helps patients reclaim their lives from a condition that really tries to take everything.
It reminds us that treating a human being is fundamentally different from just treating localized cellular dysfunction.
It really is. We aren't just isolated cells.
No, we aren't. And honestly, even if you never have to deal with lichen sclerosus, this deep dive demonstrates the massive value of not settling for just suppressing our symptoms.
So true.
Whether you're dealing with a skin condition, chronic fatigue, or even just relentless migraines, true health usually requires bridging the gap between Western targeted treatments and Eastern whole system support.
The body is an interconnected network. We really have to stop viewing it as a collection of isolated parts that operate independently of one another.
Which leaves us with a final thought for you to mull over today. If a severe, highly localized skin condition like lichen sclerosus is actually deeply intertwined with gut permeability, a lack of sleep, and nervous system stress,
Yeah.
what other isolated physical symptoms are you currently treating as purely local problems? They might actually be the alarm bells of your internal ecosystem crying out for systemic balance. The arsonist might not be anywhere near where you see the smoke.
It completely changes how you view every unexplained ache, pain, or rash, doesn't it?
It changes the whole paradigm. Until next time, keep digging deeper.